When you come to the Center for Infertility, both partners are evaluated. For male partners or people born with male genitalia, we require a comprehensive semen analysis as a first step in understanding male fertility. And today on Lunchtime Live with the Center, lab technician and andrologist Michael Craven is sharing the 411 on semen analysis. Mike, welcome.
Thank you for having me.
So let's just start with what it is. So, what is semen analysis and how is it done?
Well, the semen analysis is just a way to quantify male fertility. So I like to break it down into two different steps. If you're using a comprehensive semen analysis, we have our wet mount, which is basically looking at your concentration, your motility, any round cells or pH in there, and your volume. And then the morphology, which is the other side of that comprehensive semen analysis, is looking more at the shape, the size of the sperm, whether they're correctly shaped. And then if you had high round cells in your sample, we would identify those.
Okay, so what do you mean by round cells?
Well, a round cell, excuse me, is on the wet mount. It doesn't look like anything. It's basically just a circular artifact on the slide, and we don't really know what that is, so we'll stain it up. And it could be either immature sperm, a white blood cell, or just cellular debris.
Okay. So what's the difference between a semen analysis and well, what's the difference between semen and sperm is really what I want to ask.
Oh, good question. So semen you can think of as like the whole picture. It has sperm as well as a bunch of other fluids from accessory glands in the male body that help, protect the semen from pH changes. It help the sperm move, and it also gives them energy.
Hmm.
And sperm, are just the cells that are part of that semen. So it's basically those tadpole-like moving things that you see in caricatures and all around. That's what we count.
Okay. And is it important to look at the fluid as well as the actual sperm themselves?
Yes, it is. It's the fluid, like the semen, if that's what you're talking about, is
Mhm.
important because if you have issues with the pH, that can affect the sperm quality. So if your
Ah,
pH dips below 7.2, it starts getting more acidic. It can cause those sperm to either die or be not functioning that well. They'll just be sitting there, maybe twitching and not going anywhere. And the same for pHs that get more basic.
is it important? So it's important to know the pH. Is there a way to improve pH if that's the case?
That's debated. It's one of those things where if is there a way to improve your semen quality?
Hmm.
And a lot of it can be through either diet um, and other things. Maybe it's an exposure that's causing the pH, but also it can be from those round cells we talked about.
Okay.
So if you have high amounts of white blood cells that are releasing reactive oxygen species, that can kind of bring down the pH as well and cause harm to the sperm.
Who needs a sperm or semen analysis?
Um, well, anybody who's really, the short answer is anybody who's really questioning their fertility. The long answer would be, people who have been trying to get pregnant for a
Mhm.
while. Um, and you maybe the OBGYN is seeing the female partner and she'll send the male partner to us. And in that way, they can kind of rule out half of the equation. But also, we'll see people who are going to urologists and getting vasectomies, and they kind of want to know if they're sterile or not. And we
Okay.
also will count those samples well. And just to add one more thing, in addition to those two categories, we deal with cryopreservation, which would probably be a whole nother topic in and of itself.
Yeah.
But that's transgender individuals, people who are going through cancer treatments, and also military who are being deployed.
For people who are going abroad because the
Yes,
military are going away. Okay.
Mhm.
Now, what are some of the criteria what are you looking for? Um, what are the criteria you're using to measure?
Oh, good question. So we're looking at concentration, and would you like me to go over like kind of the normal versus abnormal
Sure,
levels?
that'd be great.
Yeah, yeah. So we're looking at the concentration of the sperm per milliliter. So we use the World Health Organization fifth edition for semen analysis, and it's available online if anybody wants to go look at it. But it has lower reference values within it. So for concentration, we're looking for approximately 15 million or more sperm per milliliter.
Okay.
With your volumes, you're looking for 1.5 mils or more. Progressive motility, which is all those sperm that are moving, 32% or more of the sample should be moving. And for your morphologies, you want 4% or more of the sample to be quote unquote normal looking.
Okay. So moving, that refers to motility, right?
Yes.
Okay.
Yeah. So we have three categories of motility. It's progressive motility, non-progressive motility, and non-motility. Progressive motility is kind of what we care about because it's sperm that are actually moving in a straight line or actually in some sort of direction. Non-progressive motility are these sperm that are kind of either just sitting there twitching
Mm,
or they're moving in circles. We've seen that a lot. And then non-motile sperm just don't move at all. They could either be dead or just not functional.
does and does this have to do anything? Does motility relate to, like the different parts of the sperm, or is that more morphology? Is that related to the different parts of the sperm and how they're
Both.
shaped? Okay.
Yeah. So in the shape definitely relates to motility, and that can be explained by the morphology. So um, if you have a sperm in your sample that all the tails are misshapen, they're not going to be moving that well.
Mm,
Or maybe the heads are, flattened. They may be going in circles. So um, morphology is a big predictor of motility.
okay. So what would a patient or what is the process for having a semen analysis with us at CARS?
Well, first you should talk to your doctor, whoever that may be. You want to talk to your doctor and see why you should get a semen analysis,
Mm,
and decide that you need one. You're going to get a lab order or a requisition from your doctor. Then you'll call one of our wonderful patient service representatives here at the center, make your appointment, um, and then if you need to, you can produce the sample at home, or if you are far away, you can produce a sample here at the center. But we do ask you to use a sterile cup, which we provide here at the center.
okay.
And basically, then you just come in, and it's pretty quick.
Does the person or does the patient need to abstain prior to providing a sample? How should they prepare for providing a sample?
Oh, yes. Thank you for bringing that up. So, uh, abstinence period should probably be about 2 to 7 days. That's a good period. That's what the World Health Organization has laid down.
Okay.
And it kind of notice a little bit more issues when we get past that 7 day mark or closer, you know, less than 2 days. Um, for preparing for the sample, um, the best thing, having gone through this myself, the best thing that I can say is don't overthink it. Try not to freak yourself out. It's awkward for everybody. It's always going to be awkward. So just do it, and we'll be happy to guide you through the process.
Okay. Yeah, I can imagine it can feel awkward, but you know, we're at the center, we're professionals, we definitely see it all the time and it's not awkward for us. So hopefully that provides some reassurance from but so if someone has a poor semen analysis, is there anything that can be done? I think we talked a little bit about it. Is there any, if someone has a poor semen analysis, can sperm quality be improved?
Um, yeah, that's So anything with fertility is going to be a really complicated answer.
Yeah.
But the answer is yes and no. So once again, I have to say that I'm a laboratory technician. I'm not a doctor, so I can't prescribe or diagnose stuff. But Dr. Honig, who we work closely with, has given us basically a list of
Okay.
natural remedies or things that you can do to improve, possibly improve your semen, because there is some evidence um, in the way of that. But first off, if there is an issue with the organ itself, there may not be a way to improve semen yourself because it may need some sort of surgical intervention.
Hmm.
But if there isn't, you could basically make lifestyle changes that could possibly increase your sperm, your motility, volume. We've seen it all here. We've seen guys come in with 0 counts and then they come back 4 months later with an amazing sample. Um, But what I like to do when I'm talking to patients is kind of outline the fact that spermatogenesis, or the process of making new sperm, takes about 74 days.
Hmm.
So if you think about within that 74-day time frame, if you're adding toxins to your body, such as tobacco, you're drinking heavily, you're chronically stressed, these are all going to they're definitely going to affect your body as a whole, but they're also going to affect your fertility. Um,
Okay.
so what Dr. Honig suggests is reducing tobacco, reducing your alcohol intake, even reducing your caffeine, because that can cause a stress-like reaction. Um, in addition, medications can cause issues with sperm processing or just holding them in the epididymis too. Um, so basically, just to lay out what is good for sperm is basically if you're doing what's good for your body, it's good for your sperm, your fertility.
Excellent. Excellent. Is there anything else that you want to share with us that we haven't covered, or did you have a slide that you wanted to show?
Yeah. I kind of wanted to show, since we're an andrologist, we're in the lab, um, we're not out in the open to our patients, but I did kind of want to show what we see and how we count sperm.
Let's see
So
if
let
it
me
comes up.
share a slide with you.
Ah, there it is.
So this is one of the ways we count our sperm under a microscope, and we use this special slide that's a 10 by 10 grid, and all these little dots on here are sperm in this one sample.
Wow.
So this is the least magnified, and then once you get more magnified,
Oh,
you can
yeah.
see these sperm, and this is actually video. So you can see that there's a lot of progressive motile sperm in here. These round artifacts in the semen sample here, these are the round cells that I was talking about earlier.
Oh, great.
And then here's a picture of what a morphology looks like. These are uh, dead sperm that are stained, and we kind of stain them to show the acrosome of the sperm and then the tail, because
Okay.
these cells are so small that they're really clear, actually. So um, staining them allows you to view the morphology in a really holistic way.
Excellent. Very cool. That's really great. Thanks for sharing that. And, you know, having that visual really made a difference.
Good. Yeah.
Yeah. So, all right, Mike, thank you for being here. We appreciate you.
Hey, thanks for having me. We'll see you around.
And be sure to check out our website at yukonfertility.com if you'd like to learn more or if you'd like to see a calendar of events, because we have a bunch of we have a bunch of events that you can participate in. So my name is Ami Choksi, and I will see you next time. And bye for now.